I'm Julianne from the Chesapeake Center. I'm sorry we had some technical difficulties on our last video, but we really thank you for joining us today. I first want to acknowledge that there is so many hardships going on in our country right now with COVID and the racial injustice. So we appreciate that you are watching this video and discussing this important topic about women's health before, during, and after menopause and the impact of hormones. Which is such a topic that is not openly talked about. So we are thrilled to bring this conversation to light. And I have two wonderful providers with me today, and we look forward to sharing this information. We will also have a part 2 of this as well. So feel free to comment any questions that you have on this post, and we will try to incorporate those questions into our next live event in a few weeks. Without further ado, I will welcome our two presenters who are both part of our Women's Center at the Chesapeake Center, which is, there's no one doctor for women's health. It's a multidisciplinary collaborative approach. So I'll start with Dr. Rachel Rubin. Dr. Rubin is a board-certified urologist with fellowship training in sexual medicine. She's the clinical professor of urology at Georgetown University. And she practices at IntimMedicine in Washington, D.C., where she treats both men and women with a variety of issues. Of course, menopause, pelvic pain, erectile dysfunction, and low libido, the list goes on. She is the education chair for the International Society for the Study of Women's Sexual Health and the education the associate editor for the Journal of Sexual Medicine Reviews, and to top it all off, a 2019 Washingtonian Top Doctor. So thank you, Dr. Rubin, for being with us today.
That was a mouthful. Thank you for having me.
I think I got it right, so hopefully. Thanks for coming. Sounds good. So our next guest is Dr. Madhu Rao. Dr. Rao is from the Chesapeake Center. She is an adult psychiatrist who specializes in the treatment of women with ADHD and related disorders, and she has a keen interest in working with women in their mental health, utilizing evidence-based approaches to treatment, including mindfulness, nutrition, optimal sleep, as well as medication management and psychotherapy. So Dr. Rao, welcome. Thanks again.
Thank you, Julianne.
So again, what a topic that we have here. We can probably spend a full day diving deeper into this, but we're going to scratch the surface a little bit and hopefully provide some probably unknown information about menopause for those who are interested. So my first question I have for Dr. Rubin, what is going on during menopause? We hear about hot flashes in women. What else is going on? There's so many other things.
So I honestly think menopause has the worst PR campaign in the history of the world. If you know anything at all about menopause, it's that you get hot flashes and night sweats. Those get better over time, and then it's no big deal. You just go on living. And the answer is menopause just means that you stop having a period. The ovaries stop producing hormones after a whole year, and it's the body's changed after that. So your brain needs hormones, your bones need hormones to stay strong, your sexual desire needs hormones to continue. And so menopause is just a life stage, right? It's after the ovaries stop producing their own hormones, but it's not just hot flashes and night sweats, it's many, many things. We have a picture to show up there on slide 1, hopefully, that can show you that it backaches, all of those things, and certainly what Dr. Rao is going to talk about is mental health, brain fog, fatigue, lack of concentration, depression, anxiety, ADHD, all of those things can come up during the menopausal transition and afterwards. And so it's really an important, all-encompassing women's health topic that we spend no time talking to people about.
And before I jump to Dr. Rao, so Dr. Rubin, what are the ages that women start to experience these changes? Does it vary? What are you seeing?
Absolutely, it varies. So the average age of menopause is about 52. That means That's average. That means half before and half after. And there's this period of perimenopause where maybe periods become irregular, hot flashes start, everyone tells you it's normal, it's just a part of aging, but there's plenty of symptoms and side effects of perimenopause that can be easily treated. And so women often suffer through these periods thinking, oh, I just have to hold on and it'll end soon. And that's just not the case at all. And so there are women in their 30s who experience premature ovarian failure and they go through menopause. And so it's really important to understand what's going on with the hormones in your body.
Thank you for that. So Dr. Rao, I'd love to pass it over to you. I know that you work with women with ADHD, and we see that, you know, a lot of times ADHD symptoms, especially at our center, we see a lot of women who are coming during this time with these exacerbated symptoms. So if you could shed some light on the mental health aspect, the cognitive aspect of menopause.
Yeah. So 40s are a very interesting time in a woman's life. She has a lot going on at home with children, their growing children, their needs, their mental health and well-being, supporting their partners, other relationships, and caring for aging parents. At the same time, she's trying to advance in her own career at work. While all of this is going on, the hormonal changes in her body as well as physical changes affect not only all the physical aspects of perimenopause, just like Dr. Rubin explained, but it also affects the brain. Biologically, what makes us women and progenitors are the hormones. And hormones start fluctuating from the time of puberty all the way till menopause. Puberty, menstrual cycles every month, pregnancy, and perimenopause. And perimenopause lasts for years before menopause really hits. So we see a lot of women coming to us, and they wait for a long time before they come to us and say, I'm not able to sleep. I don't know, but I feel very labile and sad, and it's very easy to cry. I'm not able to focus, and I've been working in the same job for the past 20 years, but I can't remember names of people. I walk into a meeting and I feel like I don't know what the agenda is, and I've forgotten what I'm supposed to do. So there are a lot of these kinds of symptoms that women come to us with, and there's fear, and there is a sense of something's wrong with me. I'm not doing as well as I used to in my life. There is, I also.
Sorry, Dr. Rao.
That shows the fluctuating hormones through a woman's lifespan. So these are the hormones, the ones that are produced in the ovary, predominantly estrogen and progesterone, testosterone, and melatonin is the hormone that's produced in the brain that controls sleep. So all of these hormones are declining with age, and estrogen and progesterone, particularly during the perimenopausal period. So the fluctuating estrogen that you see, so it's fighting the decline just before menopause. It's not giving up easily. And the fluctuating estrogen, some women are just more sensitive to these fluctuations in hormones, and those are the ones who experience mood changes and worsening of ADHD or executive functioning skills, as you call them.
Actually, so that is a lot of changes that we're seeing with estrogen. Is that experienced monthly, or how are those? How is it shifting with estrogen? What periods are women experiencing this?
So, menstrual cycles during the perimenopausal period become more irregular. They could be delayed, they could be shorter, they could be heavier, they could be longer. So a woman is used to a rhythm during her reproductive years, and when that rhythm is shifted, then she presents with more mood and cognitive symptoms. And the reason being it's on my slide 2, that the estrogen and progesterone receptors are in the brain as well. It's not just the body that's reacting to these hormones, but it's also the brain. As you see in the front of the brain, on the left side of the screen, the circle, that's the area of executive functioning, processing, planning, organizing, executing tasks, knowing what are the priorities, and focusing on the tasks and taking them to completion. The second circle that you see is the amygdala and the hippocampus, and those are responsible for emotional regulation and memory and processing. So as estrogen and progesterone levels drop during perimenopause, we see changes in cognition and mood.
Thank you for that. So Dr. Rubin, I also saw on there testosterone. Can you give light to kind of what role that plays in women?
Absolutely. And I couldn't agree more with Dr. Rao. Perimenopause is a very difficult transition because your highs are highs, your lows are lows, and it is all that change of hormones that can really make you symptomatic and just not feel well. And so sometimes just giving someone a little bit of safe, effective, evidence-based, FDA-approved hormone therapy can be very helpful in just leveling off their symptoms. And so there isn't so much fluctuation between their hormone levels. Testosterone is a fascinating topic in women because it's been really ignored over the years that men need testosterone and women need estrogen, and it's just not true. Men need estrogen and women need testosterone. In fact, we've been told all the time that women have very little testosterone in our body. Actually, Dr. Rao's graph showed the testosterone level as lower than the estrogen level. But if you put them in the same units, we actually have a lot more testosterone and androgens in our body than estrogens. And we were not taught that in medical school. And there's been a lot of interest in the importance of testosterone in women's health. So as of now, the only real strong evidence we have is that testosterone is important for libido. It really improves libido in postmenopausal women. But I think as we learn more about testosterone and take testosterone more seriously, we will find, similar to my male patients, that it can help decrease anxiety, it can help with some cognitive issues, it can help with some strength issues. As we know, testosterone is important for muscle health. So I think we're only beginning to learn about the importance for testosterone in women. And certainly it's complicated by the fact that there is no FDA-approved testosterone for women right now. So we have a lot of work to do to change that.
Using hormone replacement as a type of treatment. Can you just talk a little bit about what types of other treatments you use or how hormonal therapy works? What are the concerns? What are the benefits?
Happy to. You know, I think there's so much fear around hormone therapy in women. Oh, it can't be safe. Oh, it's dangerous. Oh, it causes cancer, dementia, heart disease, all these things. And people don't really understand the real evidence behind it. And so if you have a 10-minute visit with your doctor, it's much easier for the doctor to say, oh, that's not safe. You don't want to try any of that, instead of really going through what is the evidence. What actually happened in all those studies that made everybody so fearful of hormones. And so what it is we give you what your body does not have anymore. You can measure your hormone levels in your blood, and you can see that after menopause, your estrogen is close to 0. And you can use a bioidentical FDA-approved hormone replacement therapy that isn't what those studies were based on that everybody was so fearful of. And actually, those studies didn't really hold up in being as scary as everyone made them out to be. And so it takes, maybe that's for part 2, and we can go into all the details of the safety of hormone therapy. But in terms of the natural antidote to what's going on in menopause, it makes sense to use some degree, if it is safe to do so with your medical history, it makes sense to use some degree of bioidentical natural hormones that are FDA approved in treating you, and also using multidisciplinary therapy with things like ADHD treatments and antidepressive treatments should you need them. And so it takes a team approach to really treat patients, which is why I love working with Dr. Rao, because she understands the importance of that hormonal piece for general health and not just mental health.
Dr. Rao, I'd love to hear also, how you work with Dr. Rubin. So in treating women with antidepressants, so if you just want to, and other medications.
Yeah. So Dr. Rubin and I share patients from all walks of life. We have professionals and executives and school teachers who come either to me or to her. And the stage of life they come in is during perimenopause, and there are a few patients who come and who talk about their mood, and they're being treated for ADHD, and then we talk about their relationship and how their relationship with their partner is going, and they start talking about their dissatisfaction with intimacy and sexual performance, and that's when those are some cases where I send my patients to Dr. Rubin, and she takes over that part of health. There are also patients who have gone through cancer and mastectomies, and who have been treated with hormones. Treating them for depression and also making sure that their sexual health is preserved is something that Dr. Rachel Rubin and I both work together on.
Such a topic that really, again, isn't talked about with women in menopause is that sexual health piece. It almost feels taboo to talk about. Again, I think women don't understand the variety of symptoms that accompany menopause. So in terms of all of the things that you've listed, I mean, it plays a role in your self-esteem, how you feel sexually, how your sleep is going, your libido. Dr. Rubin, what are you seeing? How do you help your patients?
So I think it's really important that you mentioned that it's a taboo topic. And one thing I strongly believe in is I talk about sex like it's a medical problem, sort of like high blood pressure and diabetes, because that's really what sex is, right? Sex is just physiology, and it's medicine. Sexual health is just health. So your libido is a part of your mental health. What is your brain doing to produce dopamine and norepinephrine and healthy neurotransmitters in your brain that makes you feel desire or interested in having an orgasm? What is vaginal dryness? Is a lack of estrogen to the tissue that is a medical problem. So when your ovaries are no longer making estrogen, it affects that tissue. And so to give an example, I see male patients with prostate cancer all of the time. When a man has metastatic prostate cancer, we give him medications that take away all of his hormones, okay? He takes a medication that takes away all his hormones and basically makes him castrate. And so his symptoms are hot flashes, night sweats, depression, bone loss, osteoporosis, low libido, and erectile dysfunction. He is essentially a menopausal woman when he experiences that. And so it's really important for my menopausal women to realize that you are not broken. You are not, this is a medical thing that is happening to you, and we have many treatments for it. Yes, you could say it's natural aging, and if you are not bothered by it, then it is not a medical problem. But I think having the education to know that there are treatments available and things that don't have to make you feel so bad. We have great options for libido. We have great options for vaginal dryness and pain. I'd love to show slide number 2, if I could. One of the most rewarding things I treat as a urologist and sexual medicine specialist is genitourinary syndrome of menopause. And so when the ovaries stop making estrogen, the vagina is affected. So you have dryness, you get decreased lubrication, you get pain with sex, but you also get irritation, burning, itching, urinary frequency, urinary urgency, and you lose the acidity to your vagina to fight urinary tract infections. So this isn't just about sex, it's actually about health. right? I don't want you being a 99-year-old woman getting hospitalized for a urinary tract infection during COVID-19. And so I actually treat women, with local hormone therapy to fix that problem. And so we have to look at menopause as more than just hot flashes and night sweats. So I think we don't really truly explain that to patients as they go through, their 30s and 40s. They sort of don't know what's going to come in 50s, 60s, 70s plus. I see people who enjoy a healthy sexual life throughout. I just got off the phone last week with an 85-year-old who is going strong and has a great sex life with her partner. And there's no age with which it's going to stop being important to her.
Dr. Rao, you have anything to add to that?
I see a lot of patients as well who come to me for primarily for ADHD, and they feel like, since I've turned 40, my stimulants have not been working as well. And they also talk about how sex is not fun anymore for them. They're not able to focus while they're engaging with their partners. So those are the areas where we talk about medications, and we talk about referrals, and people take time, but they're very receptive to it and very pleased with the combined approach of treatment. There's a lot of education that needs to happen, just like Dr. Rubin pointed out, that it is a medical problem, and it is not, there's not a lack of interest or displeasure, or it's not intentional.
You're not alone. So absolutely. I know that when we were planning this whole meeting, you talked also about treatments that aren't FDA approved for this specific issue, but that work for this issue. Can you dive deeper into what those medications are and how you use them?
So I think it's important for people to understand what that means, FDA approved for. So give an example, testosterone is an FDA approved medication for men. As a doctor, I can prescribe it to a woman, knowing that they need 1/10 the dose, knowing the appropriate ways to give it to my female patients. I am allowed to, give that medication. We use all sorts of anti-seizure medications that are approved for seizures, where we use for antidepressants. So we use a lot of off-label medications for many things. Bupropion or Wellbutrin, which is an antidepressant that has been used for years to improve libido, is an off-label medication for libido, but it is used quite commonly. And so it's important. We have all sorts of treatments for sexual problems as well as menopausal symptoms. And Dr. Rao can certainly speak to the ADHD component.
Dr. Rao, I'll pass it to you.
Yes. So when women come to me in their 40s and 50s and report problems with executive functioning, it really needs a very thorough evaluation of current symptoms and also history. Is this something new, or is this something that they've had over the course of their life? And is it worsening with age? A lot of times, women actually come to me when their children get diagnosed with ADHD. And they're like, I was just like my son when I was young. I had the exact same issues as my daughter when I was young. And I was just branded as lazy and doesn't pay attention in class or not good at math. Whereas my brother, 20 years ago or 30 years ago, was diagnosed with ADHD and was put on medication and got accommodations in school. And he is now an attorney, but I just could not succeed once I went to college. So a lot of them are not diagnosed until their 40s. Some of them, the ones who are fortunate to have gotten the right interventions early on, do come and they report not feeling the same response to medications, but the ones who have never been diagnosed come and then give a history of their childhood symptoms. And at that time, it really needs a very thorough evaluation of their current symptoms, the past symptoms, and also getting some collateral information from their partners or parents or siblings. Um, we also do neuropsych testing in some cases, and there is an adult version of neuropsych testing that is done to understand the ADHD symptoms. A lot of times we see ADHD and anxiety and depression, and having comorbidities is not uncommon.
Thank you. I feel like, again, we could talk about so many different things. I want to end with my last question to both of you. So and this could be a part of our part two because it's a big question, but when women are going through this period, not only are they going through these hormonal shifts, but they might have a daughter who's a teenager who's going through similar hormonal shifts. And just how are relationships impacted? And how does treatment, by treating the menopause symptoms, how does that help with relationships? What do you see in your practice, Dr. Rubin?
So it's a great question that you bring in teenagers, right? Because when you are a baby, you have no hormones in your body. You can so much as look at a baby girl when you change her diaper, that tissue looks different than an adult woman when she has a lot of hormones. And so it's important to understand how the body is so affected by hormones when you go through puberty. So in many ways, puberty is on the way up and perimenopause is on the way down. And so teenage girls and their 40-something-year-old mothers actually have a lot in common, but it doesn't always agree with each other in terms of there can be very volatile relationships, a lot of anxiety, a lot of angst, and it can be really difficult to manage. And so we see it's all about education. It's all about talking with your partners and having them understand what's happening in your body. When people come to see me, and now it's mostly virtual initially, because so much of what I do is teaching. I show you slides, I show you pictures, I spend an hour learning your entire medical history, where you come from, and what I can do to help improve the quality of your life. And no consult is as fun as when I have a partner who's there too, who can see it along with both of us and really understand whether it's from pelvic pain, painful intercourse, low libido, or menopausal changes. When a partner understands that, oh my goodness, this is a medical issue, I sort of now understand what hormones are, I understand what your body is going through, then you can talk about it. Sex is this thing that everyone is having to some degree, even with themselves, but nobody is talking about. Most people don't even talk about it with the person they are having sex with. And so what I do is help to open that door to say, it's not hard to talk about your diabetes. And so can we talk about your libido, right? How can you talk about your sexual life as you age, in a medical context? And so that's something that we really enjoy doing in our practice.
Dr. Rao, do you have any?
Yes. So just like Dr. Rubin said, we do a lot of family counseling when there is a new diagnosis of ADHD, or when there is another family member diagnosed with ADHD, especially because the home front can get quite chaotic if it is not well managed and the family needs help. So we do medications, which is only a part of the whole treatment plan. There is ADHD coaching that is offered, and that is more about, okay, let's do a planning to transition to college. Let's help the mother who has two children with ADHD or learning differences, and how can we help her cope with her own symptoms while she helps her children, or helping somebody plan their career moves, and try and picking a career that's right for her. So this is all done with ADHD coaching. And there is also something called cognitive behavior therapy for ADHD that is offered, which works with individuals and actually sits down and says, okay, let's look at your calendar. What do you have going on this week? What do you have going on next week? And do you have a master list of things to do? Have you prioritized it? Is it organized? And do you know what is due when? And it is almost like having a coach to help you meet your goals, but give you some very tangible skills to doing it. So these are some very practical um, tips that we offer, and medications and therapy, ADHD coaching are like an integral part of treating ADHD.
So before we end, I know we're doing a part 2, and again, we'll dive deeper into all of the topics that we talked about. But what are your final thoughts? What would you like women who are watching this to know? Dr. Rubin?
I think you said it great. You know, you are not alone. This happens to everyone in their 40s and over the age of 52 for sure. And yet so many people don't get the help that they need because we don't talk about these issues. And so perimenopause is an age where you are taking care of everybody else. And it's really important to realize that if you don't put your oxygen mask on first, you can't help other people. And so you have to be your best in order to be an amazing partner, an amazing parent, an amazing daughter. And so it's really important that you take care of yourself. Sexual health is health. It's actually a marker for overall health. And so it's really important that we keep an eye on that as a way of looking at your overall health status. So I'm just so grateful you invited me on today, and I hope to do more of these in the future.
Thank you. Dr. Rao, what are your last thoughts? What do you want to please know about?
So I would like every woman to think about her own health, physical health and mental health, while she's taking care of everybody around her. And ADHD is a medical condition, and just like diabetes and hypertension, needs attention and can be treated very well. Even if you have not been diagnosed as a child, but you're coming to care at the age of 40.
Great. Thank you both so much. I look forward to our next live together. And for those of you who are watching, make sure that you like and follow our page so that you're notified of all of our upcoming events. And I just want to give my own little round of applause to Dr. Rubin and Dr. Rao. Thank you both so much.
Thank you for having us.